Welcome back. Now, we were talking about this yesterday and we thought we had to continue it today. The ongoing public health nurse shortage has led to reports of some parents getting word that their children will not receive certain developmental checkups in an effort to prioritise the work of the area's public health nurse.
So joining us to discuss the ongoing issue is a mother whose daughter will not get a developmental checkup, Kelly Donegan, and lactation consultant and former public health nurse, Kelly. Mugan, good morning to you both. Thank you so much for coming in to see us. Kelly, let's start off with you. Your daughter, Cherry, 10 months old, expecting to get a checkup any day now, but you received just I think 2 weeks ago a letter to say that she won't be receiving it.
The infamous letter, which has resulted in
What
outrage.
does it say?
Basically just states that my area, I live in Dublin 12, very close to the National Maternity Hospital, that my area is now in a priority status, which means unless your child has a very serious concern, which parents need to monitor and flag, that they will not be getting their developmental health check. No suggestion for when the next one will be. It doesn't include an extensive list of what those checks are.
For 10 months, it doesn't say this is what you
This is what you need to do. There is a QR code to the My Child book, which I do have a copy of. I received this having left the hospital from my public health nurse. And there is a brief list of what I need to look out for. And I'm lucky that I don't have any major concerns, but things like eye checks, checking the fontanellas, hips. I'm not a medical doctor. I don't have the ability to do those specialised checks.
And it's your first child.
It's my first child. I'm not an expert. I'm learning on the job.
So when you got this, because I know that you put it up online, when you got this and you're thinking about your baby, your pride and joy, how did you feel? Because you were referred to the My Child book, as you just showed there. How did you feel?
I was angry. And I don't have a huge platform. I have a small platform. And I really wanted to use it to highlight the issue. I think it's a disgrace that some children are being offered their health checks, others aren't, depending on where you live and the access to services in the area. And I don't think it's good enough. We live in a first world country. We're lucky to live in Ireland, but on the flip side, our children should be getting these checks. They're our most precious, most vulnerable members of society. I work extremely hard. My partner works really hard. We worked our buns off to buy a house in the last year. And then to find out our child isn't getting their basic healthcare needs, I'm outraged. So I'm taking it public.
Yeah.
So how detailed is the book in terms of giving steps, and how confident are you in case you get something wrong? Because as you said, I'm not a doctor. But is it very detailed? Is it something that every mother or father should be able to do you think?
There is some basic checks, which I think most parents will easily be able to do. Nobody knows their child better than their own mother.
Yeah.
But I don't have the attuned eye that a public health nurse has, especially for those small little, developmental changes. Again, those eye tests, I don't have the ability to do that. And the HSC are saying if you have a concern, go to the doctor. But the GPs are so busy, they won't do the public health nurse checks.
Yeah.
So,
and it's a vital service. Katie, you used to be a public health nurse.
Yes.
Can you tell us the role that public health nurses play and how important these are, and sort of a developmental check like this?
Yeah, look, the role of the public health nurse is crucial in supporting parents and children in this, especially in those early stages of childhood development. And the public health nurse service offers a range of services focusing on health promotion, prevention and early intervention. And I suppose the developmental checks are a key part of this. And the developmental checks can help flag or any concerns or delay in child development, particularly, I suppose, child growth, their fine and motor growth skill, or their gross and fine motor skills, language development, social interaction, and so much more. And they're carried out at kind of key areas or key times in their lives where we know they should be reaching certain milestones. And if they're not, then they can be, they're generally flagged, or we kind of see something that we think this needs either further assessment, or we will refer on to the appropriate services. So we have access to refer on to speech and language therapists, paediatric dietitians, psychologists, the area medical officer in the area. So these key developmental checks are really important. And I suppose in ways, it's unfair to put this back on parents, because parents don't often see what we see. We're experts in the field. We have babies coming in, and it's not just a developmental check. We do a full check from head to toe on the infant as well, to like hip checks, the eye checks, the weight checks, and make sure that they're kind of, I suppose, growing as they should be. And it's often as we spoke just there a little while ago, a key time that parents can actually ask questions. They can get reassurance. Infant feeding, sleep, infant care, particularly in the early stages of the parents navigating this new territory when they're newborns. It's really important that they have access to that.
And even if your child, you're not concerned about it, it just takes just a weight off your mind, something that is so important to you as well. We got a lot of messages in from public health nurses as well, talking about the stress. I'm sure you probably are still in touch with a lot of them. How difficult is it at the moment?
The stress on the ground is unbelievable. I think we have known that the number of PHNs have been declining over the years. We have more senior PHNs resigning or retiring early due to, I suppose, lack of staffing, which results in huge stress because of increased caseloads. The PHN doesn't just look after, I suppose, child and maternal health. That's something to be, like, a lot of the public aren't aware of. They look after, and I suppose, a huge cohort of society. Basically, they're vital in delivering care, community care, and the focus is more on the health and well-being of the individual across the lifespan. So from the newborn to the older age, we have an increasing ageing population. We have more complex cases coming into the community.
Well, why can't? So I'm just wondering, right? And it sounds so stressful, and we know nurses at the coalface, my God, is it a hard job? But why can't we recruit them? Like, is there a difference to being a public health nurse than there is, say, being a nurse in a ward? Like,
yeah,
is there,
it's very different nursing.
Pay scales?
Absolutely.
Are they different?
So you're considered to be a kind of, I suppose, on a senior level when you're coming into public health nursing. You've already got experience behind you. You used to have 2 registrations, so I would have done my general nursing and paediatrics as well. Others would have done general and the maternity. Then you have to go on and do a postgraduate diploma in public health nursing, which is another year. So many of these are coming from a much higher pay scale. And then for that year, you drop to very, very little. Now, you can imagine most will have a family behind them. They've got mortgages to pay. And that is very difficult to sacrifice. And to be able, we've got an increasing cost of living crisis.
Yeah.
You've got mortgages to pay, and it's just not feasible.
To do that.
The recruits that we have coming in then are coming into these positions that are left vacant for long periods. They're now coming in, and the stress on them with lack of support of having a senior PHN to guide them and support them in the early first year to 2 years post-qualification is huge.
Unbelievable.
Difficult situation. 0896 111 111. Let us know your opinion on this. As a parent, finally, Kelly, like, how frustrated are you around this?
Well, I think as a first-time parent, you're already so overstimulated, you're exhausted. I've just transitioned back to work. I went back to work 3 weeks ago, and now I've the added weight to be a health professional, and it's almost like the HSE are gaslighting the parents that you need to spot these small little details, and if you don't,
it's on you.
You're out on your own. But what we're asking people is to send in a complaint. Even though parents are tired, they're exhausted, the last thing they want to do is take on a battle and send in complaint forms. But send in a complaint to your service, your say, to the HSE directly, and continue to engage with us, because we're going to continue to highlight this, and we want more, we want better.
Well done, and I know that you were speaking to an awful lot of public health nurses about what they were doing, and they were like, thank you for doing this. Thank you so much for both coming in. Kelly Donegan, mother, 10-month-old Cherry at home, doing great, thank God. And Katie Mugan, who's a former public health nurse and now a lactation consultant. Thank you both so much for being here. We really appreciate it, guys. Thank you so much.